Welcome to Better.Do Better, presented by RX Physical Therapy, where we talk to local healthcare and fitness professionals about all things injury, recovery, health, fitness, and training. Today I sat down with Dr. Allison Heffron, who is a chiropractor and acupuncturist in Springfield, New Jersey. We spoke a little bit about how she decided to become a chiropractor and how she found her way into an acupuncture program as well. We talked a bit about who she likes to treat and how she likes to treat, so I'm sure you guys are going to enjoy the episode. Yeah, so it was actually the very first thing we did when we sat down for the course. They were like, all right, here's a 1-inch needle. You're going to needle your forearm. That was it. They were like, you gotta know what it feels like, know how to do it, and then we can move on.
Yeah. We had to spend time needling ourselves, and they had us do it in like the worst points, like not in like what we call Ren 1 or Do 1, where it's like grundle and anus.
Right.
But we had to needle ourselves in like acupuncture points that are like Li4, stomach 36. So all of those are, it's like your tibant, the web of your thumb, like those areas, which are inherently incredibly reactive and sensitive. And like they had us do it with the 2-inch needles. Or 1.5 inches, and it was just like, I don't know if that just gave me PTSD for forever. It's like we also had to freehand it, no tubing.
Oh, okay. That's
also part of it. It was like we weren't allowed to tube in school.
Really?
Yeah.
That's kind of strange. I wouldn't have thought of that as a thing.
Oh yeah, no, that's like a thing. And then like if you tube, it's like you're not good enough. And then meanwhile, like I left school and at first I was freehanding everything and I was like, fuck this, I'm just gonna use the tube. Like it's
stupid. Yeah.
Faster, it's fast. It like I don't know, like even I was thinking at first that like using the tube would make the patients less reactive, like it would be less sensitive. I think everybody's just, no matter what, it's sensitive. You're getting a needle stuck into you no matter what.
Yeah.
But with their philosophy of no tube with the needle is that you do have more control over where you're going, even if it's like slightly off. Yeah. You have so much more control over where you want to needle. But I don't know. Now at this point, I haven't freehanded in years. I freehand certain things like ears, face, certain parts of arms and legs, I'll freehand, and neck and stuff. But for the most part, scalp, I'll freehand. But for the most part, I tube everything. It's just easier.
So is there do you do like a pinch technique then if you're freehanding? Do you like pinch the skin or you just lay it flat?
It depends, because sometimes you may want to stretch the skin.
Okay.
I'm trying to think. I feel like it's like, well, I'm going to practice it on my dog without the needle.
I actually needled my dog a couple of weeks ago.
Oh yeah.
4 months ago. She was having some biceps tendonitis stuff going on. We like needled the muscles, but we ended up taking her to a doggy PT. So
we for one of my dogs, he like occasionally will get this, he'll let his like wrist will quote unquote wrist will get he'll start limping on it, and when I've needled it and when we've done soft tissue to it, it like clears up so fast.
It's so wild. It's cool to see that like your skills transfer to the ones that you love.
I know, and it's cool because it's like on animals and babies, there's no preconceived suspicions or anything over what it is that you're doing. And so they do have like the most pure response to treatment. It's like there's no such thing as placebo in them.
No, there's not, because they don't have beliefs yet.
No, so it's really cool when you do it and you see a response.
Yeah. So how did you get into it? Because you're both a doctor of chiropractic and an acupuncturist, correct?
Yes.
So what's that story?
So with it's not like very interesting. I mean, I am a third generation chiropractor. So my grandfather, my dad, and my uncle actually are all chiros, or my grandfather's passed, but so I kind of always wanted to be a chiropractor, which I like think of now, and it's like I don't think I've ever met a child that was like, I want to be a chiropractor. And so I went to undergrad, and then I remember like when I graduated, my dad actually tried to talk me out of it, because like the business of it is not what it used to be. Which from my perspective now, I'm happy that it's not, especially with the way that I've grown my practice. I don't want it to be that way. Like he had a multidisciplinary practice. It was high volume, insurance based and everything. And so he was concerned that I wouldn't be able to make a living because insurance is not the Mercedes 80s anymore. Like
I've never heard that, and I love it.
So, so yeah, he tried to talk me into doing like PT or OT or anything like that. And I was like, I really don't want to. No offense. I just didn't. I always wanted to do chiro. Yeah. And then oddly, at one point when I was younger, I went to my dad's office and he had an acupuncturist working there, and I got acupuncture by her for allergies, and I fucking hated it. I hated it so much. It was so uncomfortable because for allergies, you get needled in the face, you get needled in the hands. And I was like a teenager, like that's, that sucked. And so it's actually funny that I ended up going down that route. But when I got to chiro school, they also had a master's for acupuncture on that campus as well.
Oh, cool.
They didn't allow first year students to enroll in both. So basically, after my first year of chiro, if I still wanted to join the master's program, I could. So in that year, I was consistently getting treated with acupuncture, and I just found it so fascinating and helpful that I couldn't imagine not combining the two. And B, there was no fucking way that I was going to graduate and then go back to school to try it later. So at least let me try it now.
Yeah.
And see, I wasn't a very good student. I really wasn't.
C's get degrees.
So, whatever. But yeah, that's pretty much the story. And I would say from a philosophy perspective and practice and everything, I am like the black sheep of my family with regards to how I practice clinically and business wise. Mm-hmm. But I think that both of those have been great decisions. So,
yeah,
I think my dad he's a great chiro. We just have different beliefs in what makes chiro.
Well, from what I've seen over the last couple of years, and the more progressive chiropractors and the more progressive physical therapists, I would say that both professions are kind of moving to the same endpoint, and you see a lot of people practicing the same way, regardless of what their schooling is.
Yeah. And that's luckily we have great seminars to like get us there. It is interesting though, because like with PTs and chiros for forever, they've had like butting heads.
It makes no sense.
No. And I mean, so in the past, I think it made more sense, I guess from like insurance base, like for a chiro and a PT to work together, because like PTs would actually bring in more cash or bring in more insurance, like payments, reimbursements or whatever. And before there were rehab chiros or whatever, it's like you got an adjustment and then PTs would do like the stretching and exercise rehab. So it made it coupled nicely together in that sense. And now I think now more than ever, chiros and PTs tend to butt more heads because they feel like they are in competition with one another, because rehab chiros and PTs, especially like the progressive PTs, practice incredibly similarly. Now PTs do spinal manipulation, joint manipulation, things like that. And, chiros are now doing a lot more rehab stuff. And so, I think if you could, like, let's say you and I went into practice together, that would make sense because we were in practice together. Like,
right, exactly. We're both doing pretty much the same type of thing. Honestly, I really appreciate it. I think like no one profession has authority over movement.
Yeah.
And I see the same kind of thing with a lot of my friends who are performance coaches or personal trainers, things like that. Like, they should be doing a lot of the same stuff that I'm doing. Mm-hmm. Right. I see it all on a spectrum. Right. And there should be some overlap and some gray area on what we're doing on that spectrum. So instead of like viewing it as a turf war kind of thing, which I feel like it traditionally has, I see it as like a partnership, right? Like, hey, this is where we work together so that someone can get the most benefit from the both of us, and we can like transition in one direction or the other. Sure. And then I know that your practice is based in a gym as well, and I assume that you're kind of doing the same thing with the coaches over there.
So yeah, I mean, what's interesting is, and I think this is like, I'm pretty sure you do much more external load rehab than I do.
Okay.
Meaning, like, how am I going to say? Like, I do work in a gym, but there's no confusion. Like, I do a lot of DNS type of stuff, and like really breaking down why they can't even do a split squat in the first place. And you probably do that too. I feel like my plan of care, at least in the way that I practice, my plans of care aren't long enough where I start to load people externally. Okay. At least this is just how I practice. But I am starting to transition towards more of getting more like external load in my treatments, because I love to do strength and conditioning. And so why not bring that into my practice? So with my coaches, it's with the coaches that I work with, it's nice because like, there's no confusion as to like who's doing what for this patient. Mm-hmm. Like, oh, this person that you're working with can't squat at all, or they can't do any like glute dominant or knee dominant type of exercise because of X, Y, and Z. Send them to Allison so that she can like really break it down. Mm-hmm. Because it's not the coach's job. It's not their job to like bring you back to fucking baby movements. Mm-hmm. It's not. So, but now, like you have evolved in your practice, I'm sure, is like you start to get interested in new things. Not that strengthening is new by any means, but you just start to evolve your practice and start to change it the way that you want to. And so, yeah, I don't think that there will ever be like a competition between me and the coaches, mm-hmm. but I would like to have a better conversation about how to transition and how to co-manage them.
Right. That's always a fun thing too. I always just think about it in terms of patterns, mm-hmm. and it's almost like a green, yellow, or red light in a pattern.
Yeah.
Their hinge is fine, but their squat needs some work. So like load them in the hinge as much as you want. I'm going to take them through a squat progression, and I'll kind of give you like the weekly, hey, they're good for goblet squats. Hey, they're good for split squats. Hey, let them rip on some overhead squats. Or like, hey, you don't have to do any sort of, you don't have to hold them back on anything at this point.
Yeah.
That's kind of what I've done that's been successful.
Yeah.
But like everyone communicates a little bit different.
Yeah. Yeah. For me, it's more like, it's so funny. There have been so many times where the coaches are like, what can or can we not do with this person? I'm like, you can do anything you want as long as they say that they're not having pain. Like, yeah. I don't give a shit what you're doing as long as they're not having pain. Yep. And then like there are certain times where we're going through it and I'm just like, don't do any of this, please.
Yeah, just stop. You had mentioned DNS before, and that's something I've had some education in as well, but all of it for me was after I had graduated. Is that something that you were exposed to as part of your chiropractic curriculum, or was that all post-grad for you as well?
God, the chiro curriculum did not give us anything. This was like that. They gave us the degree and it gave us the absolute fundamentals of just like red flags and, things like that. But with regards to assessing and diagnosing and treating movement patterns, that was all extra. Like we were fortunate to have really great clubs in our school. And so that was the beginning exposure, is like our what's it called? P2P. You know what I'm talking about?
I think I do know what you're talking about. It's like pain to performance or something like that.
Yeah, but oh my God, what? Yeah, something like that. But yes, we had a club like that, which was great. So I was exposed to like Mackenzie and Liebenson and McGill all through that club. And same with motion palpation, which I don't know if you've ever heard of or if you've ever taken it. It is probably at the time, it might still be, one of the least expensive seminars I've ever taken. And it was one of the most valuable because you really learned how to assess joints, like joint palpation and everything, learned how to become a better adjuster, which was great. But then that, surprisingly, they were very progressive, and so that was where I got a lot of exposure into like DNS and all that type of stuff. And that exposure led me to taking those seminars. But yeah, that was all the MoPal and that club, that was all during school, but afterwards I was taking all those seminars.
Nice. I would probably say the same. I like learned most of that kind of stuff after school. Like I took the SFMA maybe like 6 months after I graduated, and I was like, oh, this is this neatly packaged assessment that like breaks down everything that I've been trying to figure out. And then you realize like, oh, okay, now I know like where to treat, but like I need some better ways to address this stuff. So then, you start looking at, all the different three-letter three-letter courses and say, okay, they're all kind of doing the same thing. How can I make my own style? But I know you're also pretty involved with some like foot specific rehab.
So my mind is blown with like how little information, knowing what I know now, how little information any of us have ever received on foot and ankle throughout our schooling or even seminars that we've taken. It's been very fun kind of feeling like I'm back in ground zero and I know absolutely nothing. Like it is. And for anybody who's listening that is either a clinician or a patient, especially patients, if you ever have a conversation with your doctor and they feel like they are at ground zero, you are in the right place. You are in the right place.
I'll go one even further, and I'll tell you, if your doctor tells you they don't know something, you're definitely in the right place.
Yeah.
Because that's someone who's going to go find out.
Yeah, like I'll openly admit to patients when I need to have a conversation with peers, when I need to look something up. You always want your doctor to be trying to learn like anything.
I do it in front of them sometimes. I'll pull my computer out and like Google something, and I'll be like, okay, here, look at this picture. This is what I'm thinking, and this is what I'm seeing. That's always a fun time. Like you become Dr. Google.
You're like, oh, I've never felt less confident than I do in this moment, but I think it'll help both of us.
Yeah, exactly. You may not know this, but I think one of my big foot influences is probably yours as well.
Is it Gait Happens?
Well, yeah, Dr. Courtney Conley, right?
Yeah,
So
yeah.
I took, I used to work for Exos in Dallas,
Oh, cool.
and she came several times to teach rock tape courses.
Oh, cool.
So I remember it was maybe like 12 minutes into the first day of the course, and I'm sitting there, and of course, she being who she is, she starts talking about feet and toes and big toe dorsiflexion, and she goes, okay, go ahead and like try to lift your big toe, or however it kind of rolled out. And I didn't hear anything she said the rest of the weekend because I was sitting in my chair trying to lift my big toe and like using my hands and doing whatever. But that was one of the most like eye-opening experiences for me. And she's been like such an incredible influence since then.
Amazing. That whole team. I'm like, just like, I apologize for.
No, everybody loves dogs.
Okay, hold on.
That's okay.
We got Frankie. You're go. No. Yeah, that whole team of people has just been incredibly helpful in me growing clinically, because now I'm expanding into like foot and ankle, and I want to niche out into foot and ankle, but also it has opened an entirely new lens to diagnose through, and it's crazy to see how like once you start looking at the foot, you can't help but start looking at the pelvis, and you can't help but start looking at the rib cage. And it's just like all of these things you always knew were connected, but the way that it's unfolded has just been, and it could also be that I'm far enough I have enough clinical experience at this point that it's not so far over my head that like I'm able to digest these things, but it's crazy. And then just revisiting the theory of relative motion, something that I haven't really paid a whole lot of attention to, especially like pelvic on femoral relative motion, which is just like insane. All of it.
You can get real into the weeds on some of that stuff.
Yeah, and like it is fascinating, but you also have to like pull the reins, and I think that comes with maturity of practicing also, is just like understanding when to like, because you're not going to be able to digest it all right away. At all. Just like take it in bits.
Yeah, I always felt like when I would take a course, if there was one or two things that I could like put into practice on Monday, it was a very successful weekend.
Yeah, it was worth your time and money.
Exactly.
And revisit that. How long have you been in practice?
Oh, I always get confused. I think I might be around 8 years or 9 years. So I graduated in 2014 with my degree in physical therapy. But I graduated in 2011 with my degree in athletic training as well. So I practiced all through grad school, a lot of like per diem on-field coverage kind of thing. While I was in grad school. So I feel like I've had the opportunity to see like a lot of different avenues and be, awesome. In practice in a lot of different avenues, which is giving an interesting perspective on things.
Yeah, for sure.
Which is probably why I do so much external loading when I see a football player like getting back onto the field, like, that pink dumbbell and that rubber band. I don't think it's going to do it for you, bud.
No. I would say like when when I'm saying external load versus I say external versus internal, but it kind of is internal load. It's like, DNS. It's like,
it's not easy, and it is absolutely strength training.
Yeah, and it's not pink dumbbells either, or like fucking stupid same resistance band bullshit stuff. But it's funny that you say like you get confused. Not that there was as much of a gap for me, but I also graduated Chiro in 2014.
Okay.
But I graduated Acu in 2015.
Oh, I could see that being a mind fuck.
Yeah, and so I had like this was actually funny. When I graduated Chiro, So my school was in the Finger Lakes, which is wine country. So like during that time, I started working at one of the wineries, and this woman asked me to start treating her mom for what was diagnosed as carpal tunnel syndrome. And like she was going to get surgery. And this woman was like 80 something years old. She was old.
Can
And so,
can I take a guess and say it wasn't carpal tunnel?
100%. I wasn't even a year out of practice, and I was able to diagnose that it was coming from her neck.
Right.
And this was actually funny. And this is, for the clinicians who undervalue themselves. I, I was brand new. I didn't know what I was doing home visits for this woman, and we were in like bumblefuck New York. And so I was like, I'll charge her like $50. And then one conversation, this woman told me that when her husband died, he left her a ton of money.
Oh man.
And I had already dictated the price, and I got this woman to not need surgery. And like, I was like, I can never make this mistake again.
Well, that's a pretty valuable lesson in like valuing your time and things that you do.
And also just not putting your issues of money on people.
Yep.
And your beliefs of money on people, because like you never know. And also you just need to value yourself, and if bring that point across of what your value is.
Yeah,
but I was like I had no guidance.
Oh man, yeah, we have so many resources available to us now that kind of help with that kind of stuff, but I couldn't imagine being in that same scenario. But you're in the gym now, you're doing a lot of foot stuff, a lot of DNF stuff, but like, who is a perfect patient for you? Like, who do you love to work with?
It's so funny because I'm like terrible at making my avatar, my patient avatar. Honestly, all I can think of is that they like to move. They want to move. They have goals. I would say being somebody who likes to be very active and is like 40 to 60 years old, which is a pretty big gap, but they, a lot of those people are able to, I don't know, they have not their life figured out, but like they have more of their shit together than 20 something year olds and 30 something year olds. And they will do the work that you give them. So people who I have these conversations very, transparently with people who are coming into my office, and they've not started with me yet. And if they show any signs of not being adherent to their home exercises, I have that conversation with them of like, you might not be the right fit then, because I wouldn't expect anybody to spend the amount of time or money with me and doing, like that I require, if you're not even going to do your part in it, because kids are also pretty good with staying adherent, especially like elite athlete kids, youth. They're really good, but I would say like the older population who likes to stay active, a lot of them have more of the why, like why they want to get better. And that's, as you know, like that's extremely important for people to be compliant with their care. Kids, a lot of them, it's just like, I want to be able to play. Okay. That's kind of as deep as it's going to get. Like,
yeah.
They don't really have the like,
there's not 3 more steps to that why.
No, and they don't have like their future is like, I'm going to be able to continue playing forever, and like I'm never going to feel pain. And it's like, meanwhile 40s, 50s, 60s, like they know what pain is. So and they know what it does to them. So I would probably say the biggest thing that would make a perfect patient is them having a strong enough why for getting better that goes beyond I have pain and it is annoying, or I don't like pain. It's like, nobody likes pain. It annoys everybody. Why is it so important to get rid of it? It's kind of a general thing, but
Yeah, that's a big part of the conversation that I end up having with people as well.
Yeah.
'Cause, you know, I found at least that no one really gives a shit if their shoulder hurts. They care that their shoulder pain keeps them from doing something. So I
Yeah.
just keep asking questions until I understand like what that thing is. I feel like I'm also starting to see that same age group, that 40 to 60 age group, and I'm curious if you're kind of seeing it as well. They seem to be prioritizing their health from a long-term perspective, more than people who have already passed through that age bracket.
Yeah.
Are you seeing that as well?
I would say so. There have been, yeah, there have been I'm trying to think. I feel like I just don't get a tremendous amount of like 70 plus. The ones that I have gotten, they are concerned about aging well and
Right.
continuing to be able to do what they want to do. I would say that the 40 to 60 age group is just more in tuned with wanting to age well rather than the younger population. They just, it's like, I know, and I'm 33. When I was 21, I didn't know what the fuck aging was. Like, I didn't, if my back hurt, I'd be like, okay, let me get an adjustment, and that would be all I needed.
I thought
And
aging was drinking a beer from last night.
yeah, yeah. And now it's like, uh, in my 30s, I, not saying that I'm like completely broken down, but I have much more awareness of the importance of you use it or you lose it. And like, but not, that's just because that's what we know. It's our profession. Not most 30-year-olds, I feel like they don't really realize, they know that they feel like shit, but they don't know that you cannot feel like shit.
Mm-hmm. Yeah. Wow.
Yeah.
You put it so perfectly, so succinctly like that. I even have friends that I went to college with. They've come to see me, and 6 visits later, they're like, "Oh wow, I feel like I did when I was 21. Like, what the hell?
Yeah.
I could have been doing this. I could have felt like this for the last 10 years. Like,
Yeah. I also love when you give somebody home exercise and they're like, so do I have to do this for forever? It's like, you should have been doing this for forever before this happened. Like,
yeah."
so yes. Like,
I definitely feel lucky in that sense, because I don't go out of my way to do any like specific mobility drills,
yeah.
for the most part, right?
Yeah.
But I get to get 100 reps of mobility stuff in every day,
Yes.
or every week, just as demonstration. So like,
Exactly.
I try to switch up which hand I'm showing something with or which foot I'm showing something with,
Yep.
so
Yep.
I can get my work in and not have to really think about it.
I feel the same way. I'm like, it's terrible because like in my head, I'm like, I'm not really great at practicing what I preach, but it's like, no, I'm demonstrating this shit all the fucking time,
Yeah.
always doing this, and I am regularly lifting, which is a whole different source of mobility.
Mm-hmm.
But it's funny because like there's so many people that I follow on Instagram, and I'm like, I'm when I first, because I took FRC a while ago.
Mm-hmm.
And then I took Kinstretch over the pandemic, like
Oh, okay.
virtually. And then I started getting introduced to like a lot of hardcore Kinstretch people on Instagram.
Okay.
And like their whole life is just like themselves they are lifting, but they do a tremendous amount of their own Kinstretch. And I'm just like, I just don't have I don't have the patience to do this all the time.
No, for every joint, every day.
Yeah. And I started moving away from, now I'm just annoyed by those accounts because I'm like, the expectation that my patient, like I can't even expect for them to do Pales rails every day.
Mm-hmm.
I'm not, you know what Pales rails are?
I do, yeah.
Yeah. So like there's certain people that I'll give it to, but for the most part, like, no,
Mm-hmm.
give them a modified thing.
Yeah. Yeah. It's more important that they move.
Yes.
More than how they move, or like the specific camp that you provide them an exercise through, right?
Yeah.
Because for them, like, that's getting into the weeds, that's getting into the specifics, right? Where most people just need to like breathe a little bit better and get a little bit more volume of movement in.
Yeah.
You know, I don't know about you, but I found that like most of what we're seeing is like environmental and habitual, right? We're just trying to change the environment that people live in and the habits that they have throughout the day, right? So they sit all day. All right. Well, we need to find a way to counteract sitting. For people like you and I, we get our work in by demonstrating because we're not sitting all day. Our environment and our habit is different, so our bodies feel different. They move a little bit different. Whereas for these other people, like just giving them a little bit of something goes a long, long way.
Yeah, we are really fortunate that like in our style of practice that we are not really sitting for that much. Like I will sit down at my computer when I have patients on with needles for acupuncture for like 15 minutes, but then the rest of the appointment I'm moving around and like yeah, pretty much all my patients, they don't do that. It's like and then me telling them when they're on calls, if they can be, you know, blocked out or if it doesn't matter if they're pacing around, pace around while you're on calls. And it's just, it is very surprising to me how many excuses people can find to not just do the bare minimum.
Right. Take your call in a squat, sit on the floor while you're taking your call. Like
just get the fuck out of your chair. Like I don't think that people are going to give you a hard time if you are in an upright position on the ground.
No, I don't think
you're not lying down on camera while you're in a business meeting, you're fine.
In fact, some of them might do it with you.
Yeah. You should just like make it a thing. But it's very accurate that like most people just all they need is to just move. A little bit more than you're doing. Yeah. It's almost, I mean, not to say that the exercises that we prescribe are not helpful, because they are helpful in building movement patterns, but I'm sure a lot of the benefit that people are getting is solely just from the fact that they are moving into another position for even a couple times a day.
Yep. You get 8 minutes where your body's moving in a way that it probably hasn't in years.
Yeah.
You know,
I love bringing people, like when I'm doing table tests and everything and measuring like hip active, passive and active, like hip internal rotation. They're like, my hip's supposed to do that. I'm like, yes.
Actually, it's supposed to do a lot more than that.
Yeah. Like you had no idea that you were ever supposed to be in this position. And yet it is a key requirement to walk.
Yeah, exactly. No wonder your back hurts after you go around the block, you know?
Yeah, it is crazy. Like, and it's not their fault.
No, not at all.
Not their fault. It's just it's shitty that like that's just not, you know, like in yoga, everything's like hip external rotation. Like just I have a patient who is a yoga instructor, and like, you know, I've introduced her to some principles of these things, and she's incorporating it into her classes. And it's like, your clients are so lucky that you can now pass on this information so that they go into ranges that like they should have been in for forever.
Yeah. So I work with a lot of the coaches here in a professional role as well. And my favorite thing is when they've started taking some of the mobility drills that I've given to them and incorporating them into the workout or the warm up for the entire class.
Yeah.
And then I see it, I'm walking up the stairs and I see what's going on downstairs and I'm like, yes.
Yeah.
I just get so excited, you know, when you can touch that many people's lives, it's cool.
So, you know, after this whole disaster on my ankle, before that, I was leading my roller derby team in like the mobility and, you know, warm up drills and everything. And when I left, obviously, like I wasn't going to practice because I can't really go there right now, but even just to watch is like uncomfortable at the moment. But one of my good friends on the team, she absorbed everything that I did And now she brings everyone through and cues them exactly how I cue them.
Yes.
She memorized verbatim.
She's parroting.
Yes. And when she told me that, I was like, you have no idea how amazing it is that like I could leave and yet you can the fact that I taught you something, that's like all any of us ever want for our patients, is that we teach them and they're able to not just regurgitate information, but like do it.
Yep.
And so that was a very proud moment.
Oh yeah. I don't want them to need me.
Yeah, exactly. And I say that to people. It's like, as much as I really enjoy you, I don't want you in my office.
Yeah, exactly. So I feel like you like to, or you do attack things from so many different angles. I'm curious, like what you see about what you do, or like how is it that, or how is your practice unique to other chiropractors or other PTs that kind of are in the same space?
You mean in like the rehab space?
Yeah.
Yeah. So not like me versus traditional chiro.
Well, you pick like different than, what is it that's unique to Allison's practice compared to like anybody else's?
I feel like that's such a like the answer is going to be narcissistic no matter, no matter what. It's like, why am I, like a great option for you? And it's like, I mean, I think it's just the way that like the lens of diagnostics that I use. I don't I don't know. I don't really use much clinical language with people because people don't fucking care. I actually I find it to be kind of a red flag when patients come into my office using a lot of jargon, because I know that they don't actually know as much as they think they know. And I won't use that language with them. Like, I still won't. And I think that doing that has allowed my brain to kind of, I don't know, just visualize people as puzzles a little bit better, because I'm not so concerned about very anatomical things, even though it is, I feel like I'm not making any sense. It's just like, I'm trying to view somebody in their entire movement pattern. I don't really fixate on one area. Even if you're coming to me with low back pain, if I'm looking at your gait, I care that your low back hurts, but I don't care about your low back at the same time. I care about what is happening globally that is contributing to this problem. And I think that that's where a lot of success comes from. And I try and my best to explain to patients what I'm seeing, why this is happening, and that it's never just one thing. It is so many things. And so it takes time to correct all this. And yeah, I think that's really it, is that I visualize people as movement. I mean, I see them as people, but I'm looking at them from full movement patterns, and I am extremely transparent with them, and I don't use clinical language. And I think that is especially that last part, I think that that's a really big reason why I have success in my practice, is that I don't use a ton of clinical language because they won't understand it. And I'm not saying that they're stupid or dumb. It's just not their job. That is my job as a clinician, to understand how to be sufficient clinically, good clinically, to the point where I can explain it to anybody. And that is a very important part of my practice. I put a lot of effort into how I communicate with people. So
yeah, I feel like communication is so key, and it gets so overlooked.
Mhm.
And I definitely appreciate your perspective on patterns. I don't know if you like picture this in your head, but this is what I see happening when I like watch somebody move. I just have like a series of cogwheels
Yeah.
like as they're going. And
Yeah.
when I see something that's like out of whack, I'm like, ooh, which wheel isn't, who do we got to grease? You know
Yeah.
what I mean? Like something's not happening here. And it just like you said, it might have nothing to do with their low back, even though their lower back is what's hurting. Ooh, that big toe is not getting into a position that it needs to, or there's
Yeah.
no hip extension happening.
Yeah.
Like, we got to figure out why is this guy doing more than they should.
Yes.
But I very much appreciate your perspective on things and how you attack.
The best is just watching somebody's gait and watching it a million times and being like, I don't know. Just I see so many problems.
Yeah.
Which plane? I got to look at this from like every angle. And then at a certain point, you're just like, I just have to start execute, like not at a certain point right away. I have to start executing something. And so, because like it is so hard to visualize everything from sagittal, frontal, and transverse planes all at once.
Mm-hmm.
Transverse is like,
It's the last thing we attack.
it's like, unless you have a drone,
Yeah.
you're not seeing it.
Uh-uh.
And so you just have to, and this is, another thing is like, you're not always going to get it right. And you have to have that conversation with your patients also of just like, we're going to do this. And then if we're not seeing improvement, then we're going to do something else.
Mm-hmm.
It's not, if we're not seeing improvement, I can't help you. It's like,
yeah, this is what I think the problem is. We're going to try. And then if we have to regroup, we do. I actually had that conversation with somebody this morning.
Yeah. But that's also why I don't know if you do plans of care, but that's a big part of why I will do a script of a plan of care, is because I am not interested in having somebody come to me because pain is the first thing to go.
Yeah.
Like that's a quick one. It's the easiest thing. If you are just concerned, and this goes back to the why, if this is the only thing you are concerned about of getting rid of your pain, go to somebody way less expensive than me.
Mm-hmm.
I promise you'll get out of pain.
Yeah.
If you're interested in a long-term solution, if you're interested in this not being your problem anymore, or it being way less of a problem in the future, then come to me. But sorry, my dog is tearing something apart.
Okay. You couldn't get over there even if you wanted to right now.
Oh, no. I hear him tearing apart my other dog's bed. So,
excellent.
What was I going to say? So yeah, the reason why I have a plan of care is so that like people don't come to me, they feel better after 4 visits, and then they stop coming. And then later on their pain comes back, and then it's my name on the line. Right. Or
yeah, Allison didn't help
better.
Me,
They don't get better after 4 visits or whatever, and they don't have a conversation with me about it. And again, it's my name that, oh, she didn't help me. Well, I gave you a prescription for a reason, because it takes time. Mm-hmm. And so do you do plans of care, or are you kind of like one?
No, I do plans of care, and I'm pretty specific about, I have like different packages that I recommend to people, and I tell them exactly who and what each package is for.
Yes.
And I tell them like, look, this one's for you, this one's not, this is where we should go,
Yeah.
And this is why.
Yeah. And I require a commitment.
Yeah.
You have to commit to all of them that day.
Mm-hmm.
And like that's kind of it. I mean, and I would say, I know like on Instagram, there's a lot of like, there's a lot of shitty people out there, but like, then there's a lot of people who are fear mongering on either end. There's the fear mongers of like, you need to have, care for the rest of your life or you'll die. And then there's the fear mongers of like, if a clinician tells you about a plan of care and they're asking you to be like commit to a plan of care, they're fucking lying to you. And it's like, what world do you live in that things get better after a visit?
Yep. Yep. I'm always curious about those people. Like, I'd like to be in your office.
Doing well.
Yeah. You know, what Kool-Aid do you have?
Yeah.
You know, that's working so well. I would love to find out.
Yeah. I don't understand. I also just am curious from a business perspective how they do.
You know, yeah.
You're discharging people after 2 visits, but you like, are you actually getting those people better? Are you making any money? I don't understand.
I mean, they've got a lot of time to post on Instagram, so
yeah, and that's pretty much their life.
Right. So what's something that you wish people knew about acupuncture or chiropractic, or how you kind of combine the two, that might get muddied in the mainstream, or, you know?
Oh my God, that's so easy for chiro. For chiro, everybody is afraid of chiropractors because they think several things. They think they're going to be quote unquote addicted to adjustments, that they'll have to have them for forever. They think that they'll die if they get their neck adjusted because Hollywood makes it seem like you can die with a neck adjustment. And then there are also, like, unfortunately, a lot of creepy chiropractors, and that is terrible. The way that I would say this in any other, you know, like I've been to shitty primary care doctors. I found a new one. I just found a better one. And so I definitely look on, you know, for referrals, like from people, you know. And I'm not even saying that like just the adjustment, like if you jive with a chiro where all they do is an adjustment and put you on heat and stim, cool, good for you. Do what makes you feel good.
Mm-hmm.
A lot of people are looking for more, and chiros like that exist where they are like me. They'll spend an hour with you, customize a custom tailored plan for your needs. So whatever you're looking for is out there. You just have to spend more time than just Googling, or more time than looking at your insurance plan to see who's covered. And if you are looking for somebody who, like me or like you will have to pay. Like, it will cost you money because great care is not cheap. And and I think that's a really hard thing for people to, and I have empathy for people with that. Like, they pay they're paying high premiums for health insurance, but if you
want to use it,
but if you want optimal care, unfortunately, it's going to be outside of insurance. That's just the way that it is. It sucks.
It's so true.
Yeah, it's shitty. I mean, it's the same thing with PTs. Mm-hmm. With regards to acupuncture, I would say it's not painless. I think a lot of people have this idea that acupuncture feels really soothing, and it like,
be so relaxing.
My needles are not made of stuffed animals. They are needles. They are still needles. They're not hypodermic needles where you get your blood drawn, but they are still needles. And the way that I needle is aggressive. So that's also, not everybody likes that style. There are more gentle acupuncturists out there. I'm biased towards the way that I do it because I think it gets a great outcome. It is, I would say, the way that I do acupuncture does resemble dry needling. But I also do, like, if I see that I have a patient where stress is really contributing to their symptoms, I will do a more traditional Chinese approach. So it is cool that combining both, I do have the freedom and more diagnostic lenses to use of like, oh, this is definitely, like, I've had patients where I know that their pain is much worse because of their insomnia or they are highly stressed, and those things do great with acupuncture. And then their pain significantly subsides, which is awesome. So just kind of being able to have that ability to combine the two is really cool. I think that's it.
I love hearing all of that. I've had so much fun on this conversation, this podcast today. So I'm really excited to, get this one out and have everybody hear it. But for everybody who's listening right now, if they're interested in finding out more about you or finding out how to work with you or anything like that, where can people find you? How can they reach out and get involved?
So I am on Instagram at Adjust Your Performance. My website is adjustyourperformance.com. If you want to schedule an initial call, it will actually be with my patient care coordinator first, because we want to make sure that you're the right fit for our practice before we take you on. And so we do things a little bit slower than a lot of people, where we want to make sure that we're the right fit for one another. And we don't want to, we never want to take anybody's money or time when they're not the right fit. So we have a few steps before we actually work together, which can be really unusual and uncomfortable for people. But I promise it's all in your benefit. And so if you want to email me, you're more than welcome to at Dr. Allison at adjustyourperformance.com. And you can find that on my website. There's also a form to fill out on my website. So there are many ways where you could get in touch with me, and I will respond or have my team reach out to you.
Awesome. Thank you so much. Thanks for listening, everybody.
Thank you.